Yep.
All right, ladies and gentlemen, we're here with Cole Killpack, from pain to pain free, by utilizing a little bit of my help and everything that we have to offer in the Back Pain Bible. Cole, tell us a little bit about the injury and how all this stuff started.
So just a little background. I'm 27 now, and then when I was 18, I was in a car accident, and then when I was 21, I was playing basketball and I fell on my tailbone, left glute area, pretty hard. And I was pretty young, so I was sore for a few weeks, but after that I felt fine. And then a couple of years ago, I started having issues. I herniated my L5S1, 8 millimeters, which is pretty significant.
So this is what I tell people in the Back Pain Bible, and every one of my clients, we all had an injury, we just didn't know it. Okay, so you have a car accident, doctors say you're fine, you fall on your tailbone, you're a little bit bruised, ha ha ha, maybe you laugh about it. You're young, no big deal, you keep moving, you don't have any problems for 5 years, and then all of a sudden the body's just like, stop what you're doing. And nobody really puts these together. Nobody's like, oh, it may have been the accident, or it may have been when I fell on my tailbone 5 years ago. We have this lag kind of where we're just living our life, but in the background, fascia's tightening up, discs are getting compressed, nerves are being choked, right? And then all of a sudden, when the body doesn't have space to operate anymore, we can't operate anymore. and we get in intense pain. So you ended up sending me an email, and we got on a couple of calls, Zoom calls. We did a couple of maneuvers. You were feeling really good. We felt like everything was taken care of. I kind of realized that the issue primarily was coming from the shoulders. We fixed that, and then a whole bunch of months went by, and your body told you that we still have a problem in there that we didn't fix. So just talk about that a little bit.
Yeah, so like Chris said, we worked on the back first, and I would say within a month, my back pain was completely gone. So I thought I was in the clear. And then a month ago, my left glute, I just felt like some weird muscle spasm. And apparently that just like that spasm, I don't know if it was like a spasm or what it was, but it took me off for like a whole week of work. And then Chris told me like what to do. So I started taking hot Epsom salt baths and used a lacrosse ball on my left glute. And before, we had been doing that via Zoom, but I don't think I was putting enough pressure or finding the right spot. But when I found it, it started to slowly release. I was just working through it daily, and there was just one day where just the pain was gone.
Awesome, man. So you were telling me a little bit about the flexibility issues where could you demonstrate that for us, where when it was locked up, or even prior to that, you really couldn't even bend over, and now you're getting all the way down, touching your toes after doing the trigger point work and the Epsom salt baths?
Yeah. Like my range of motion, my pelvis would barely, like, I would say that's as far as I could go. And I think Chris has like some old videos, but yeah, like, I could do that, like no problem. I could touch my toes too. But I need to warm up for that.
Sure. Yeah. So, this is another thing, pain, restriction, motility or mobility, our ability to move just like a normal human being, bend over, pick up keys, bend over, pick up a pencil, bend over, pick up my socks. Can you do something like that? That's our motility. That's what a normal human being should be able to do whenever they want to, right?
Yeah.
Now, when we're talking about extreme flexibility, like a gymnast, I mean, really, yogis, gymnasts are really only going to fit into that category. Maybe ballerinas, dancers as well.
Yeah.
That's uncommon. People work to that. So what we talk about in the back pain Bible is with those stretches, all we're really looking to do is regain a normal range of motion, which you did. If you're telling me that you couldn't even bend over before, you know, a 16th of the way, and now you're getting all the way down, almost touching your toes. I mean, you know, that's pretty normal to me. Not
Yeah.
everybody, you know, you pull 9 out of 10 people out of their car, they're probably not going to be able to touch their toes. They'll get close and they probably won't do it with pain, you know, but that is all we're looking to achieve. Just we want to go from pain to being a normal human being again, and super stoked to help you make that happen, bro.
I know. Like like I've talked to you in the past. Like I did spinal decompression therapy, saw 4 to 5 physical therapists, like 5, 6 chiropractors, and nothing was working. But I think no one ever thought to look at my glute.
Yeah, yeah, absolutely. Huge source of low back pain. The amount of times that I've worked in somebody's glute or had them work in their glute and their back pain just dissolves, it's astronomical. You know,
Yeah,
you don't ever want to look, I don't want to say never, most of the time you're not going to be looking towards the symptom. The back pain isn't the symptom. I'm sorry, the back pain isn't the problem, it's the symptom.
yeah,
So you have pain in your lower back, we need to find out where the problem is. The problem gets fixed, the pain goes away instantaneously, right?
uh,
You keep on treating a symptom and you're going to treat and treat and treat, and you feel good, it'll come back, you feel good, it come back, et cetera,
yeah.
so on down the line. Really appreciate you doing this for me today, man. Is there anything else you wanted to tell anybody out there?
I would just say to be patient. The road to recovery. There's definitely a lot of like positive days, but there was also some days where yeah, the pain was like, pretty unbearable to do stuff, but it's important to try to work through it. Um, but yeah, just keep working and stay persistent with it. But yeah, I would say I'm completely pain free. Just a little stiff because I haven't like moved my body that way in almost 2 years.
Yeah,
That's just gonna come with time too. I'm gonna take up some hot yoga to
there you go.
loosen me up.
Yeah, that's awesome, man. Now that you got out of pain, you can go and start to increase your flexibility. What I don't like is when people are in pain and somebody's like, oh, go to yoga. And then they're
Yeah,
doing back bends, downward dog, they're doing tree poses, like all these really, even for me, a guy who, you know, lives his life with mobility and just being flexible and whatnot. If I go into a yoga class, I get my butt kicked by the people that are always going to yoga, you know,
yeah,
but I don't have any injuries. I don't have any problems. I don't have any stiffness or pain or anything like that. 43 years old, you know? So that's all we want people to do is just be human and do the things that they want to do with their life. Live pain-free, be happy, be healthy. That was a really great point about the patience part, because westernized medicine is going to say, hey, you know, we can have you in surgery tomorrow and you'll be pain free the next day after a little bit of rehab, or we can give you an injection, or we can give you pills and it's going to take the pain away like that. So when people are looking at maneuvers in the back pain Bible or other modalities, they're like kind of conflicted, like, wait a minute, if I take a pill my back pain goes away instantly, but I got to take a pill for the rest of my life, right? Which is
yeah,
going to do untold damage to my gastrointestinal area, etc. Or if I just work through the problem in my body, at some points or some days, it may be very hard, like you said, but
yeah.
when you keep on working on the problem and opening up that problem, the pain then goes away permanently, and we don't have to worry about it anymore.
Exactly.
So same with me too. You know, I'm like, okay, well, I rolled on my quad and my knee pain feels a little bit better. How come it didn't stay away? I wasn't working on the full problem.
Yeah.
So thank you once again for
Thank
this.
you.
Yeah, no problem, man. And I look forward, if anything in the future, to help you or anybody else that you know.
Yep, exactly. Yep. Thank you, Chris. I appreciate it.
No problem, man.